Does obesity hide endometriosis? Now, endometriosis affects about 1 in 10 women in reproductive age and is a major cause of chronic pelvic pain and infertility. Obesity, on the other hand, is a global endemic. You might expect that more body fat would simply mean more endometriosis, but that data is not that simple. In fact, large observational studies show that women with endometriosis often have a lower BMI than women without the condition, and each 5 point increase in BMI is associated with about a 15 to 20% lower chance of being diagnosed with endometriosis. So the question is higher weight protective? Probably not. The review today explains the pattern shaped by diagnostic bias and a complex biology. Lean women with severe pelvic pain may be more likely to be investigated and diagnosed. Meanwhile, when obese women have endometriosis, that disease looks different. More systemic inflammation, more metabolic comorbidities, and in many cases, more severe or refractory symptoms. A central character in the study is leptin, a hormone produced by the fat tissue. In healthy system, the leptin tells the brain how much energy is stored. In obesity, leptin levels are chronically high and the body becomes resistant to its regulatory effects. In the context of endometriosis, the excess leptin becomes a problem. Multiple studies have shown that higher leptin in blood and peritoneal fluid in women with endometriosis. In experimental models, leptin turns on the inflammatory pathways, stimulating new vessel growth and helps ectopic lesions implant and survive. This review also highlights other adipokines such as adiponectin, which is generally anti-inflammatory and often reduced in both obesity and endometriosis, tilting the balance towards chronic inflammation. The big picture is that endometriosis and obesity share the same molecular pathways that connect fat tissue, immune cells, and ectopic endometrial cells and tissues. What does that mean? It suggests that we should think of endometriosis as a broader metabolic and inflammatory landscape. And while endometriosis in the obese may be picked up less easily, it may be following a different inflammatory pathway, making it more severe in some cases. And that's the reason why investigating it even more aggressively and treating it variably is something which we'll need to think about.